This is Suchitra Vijayan, and thank you so much for joining us for the Dispatches series. With communities around the world currently living under various degrees of quarantine, lockdowns, and even curfews, these conversations are a way to center and amplify diverse voices, concerns, and struggles. We are living through a unique historical moment that requires solidarity, empathy, and more importantly, ways to affirm our humanity. In the coming weeks and months will be chaotic, and along with it, unprecedented expansion of executive power that will encroach civil liberties and further expand surveillance architecture and entrench the already existing inequalities. Borders will be sealed, and the communities already struggling under state violence will be living through conflicts that will become invisible and erased in news cycles. Joining us today to talk about an important issue that is playing out in India, the migrant crisis, are journalist Rachel Chitra and lawyer Aman. Rachel Chitra is currently works as a journalist for the Times of India, Bangalore, and she tracks finance, rural distress, and labor issues. Aman is a lawyer by training and is currently teaching at the Jindal Global Law School. Aman, along with his PhD students Kanika Sharma at MROI and Krishna at Syracuse University, is currently maintaining a database of lockdown deaths. Similarly, Rachel has been, as a single, someone who introduced me to Rachel's work said the one man army has been again documenting.
We've both been sharing our database. Like, I don't understand Hindi, so I'm taking a lot from Aman, and I think Aman takes some of my Tamil, whatever deaths are happening, which are reported in Tamil media.
Be quoting
Yeah.
someone who messaged me. There's a single woman army out there like documenting the death. So I'm simply quoting someone else who's also been documenting the deaths that have been happening during the migrant crisis. We will be putting the links to both of these public data sets and data. Before we start, I just kind of wanted to start with Rachel. Rachel, can you kind of lay out for our listeners and audience how this crisis started? Perhaps a very tight deadline, and then we can go on to talk about the methodology and documenting the crisis and the deaths that have happened.
Sure, I'd like to. So, going back, this was May 25th, and it was the evening, and we were all expecting the Prime Minister to make an announcement. And we were told, I mean, imagine we are a population of 130 crore people, it's like 1.3 billion, and we are told overnight, like with 4 hours of preparation, that we are going to go into a total and complete lockdown. So, what that led to the next day morning itself, you could see thousands of migrant workers at the railway stations, at buses, and then they were told, and there was not proper communication. They came there expecting that there would be transport to go back home, and they didn't get the transport, and many of these people then decided to walk back home. And so I remember the very first death that was reported was this Ranveer Singh. He was a Zomato delivery boy, food delivery boy, and he was the father of 3 children. And when that death happened, everybody, all the newspapers, everyone wrote about it. And then what happened is, I think we became desensitized because seeing more deaths, more deaths, more migrant deaths, more migrant deaths. And this first wave of people who migrated, like between March and April first week, where I think because going through news reports, were largely daily wagers, people who just couldn't stay another day in the city if they were not getting paid. Then you had like a little bit of a lull where there were sporadic deaths, and then again it picked up pace, like and these, I feel, were people who couldn't pay rent, who found it unaffordable to stay in the place of migration in big cities like Mumbai, Delhi, and Bangalore. And then started the next wave, and that's when you saw the most tragic incident where 17 migrant workers were killed in that Aurangabad train incident. They were sleeping on the tracks, and even that in a way shocked me, because I don't know what we are becoming as a nation. There were so many people criticizing them, saying, "Are they stupid? Why are they sleeping on the tracks?" I feel that way. Like maybe the media has not like fully told their story, because in so many of the media reports, they were just referred to as 16 or 17 unknown migrant workers who died in the Aurangabad. Why couldn't we have got their names? At least their name, their age. Isn't that like the minimum, the bare minimum that you would do as a reporter? Because there was also this class bias that I was seeing in all the media reports, because I was documenting it, and I was seeing that if it was a techie who died, if it was a techie who committed suicide, there was this person who had returned from Australia who had jumped off a hospital building in Delhi. That was reported so widely. primarily because the person came from a middle class background, and they reported everything about his height, weight, when he returned from Australia, everything. And 17 people died in the Aurangabad incident, and you can't even get their names. It's and it that just goes on. It has gone on. Yesterday we saw that child, I mean a 2-year-old child, tugging at the sheet that was covering his mother. The boy didn't even realize his mother had died. You can see that in his expression. He's just playing around the body, and it was so horrific. And even that doesn't seem to have shaken the conscience of our nation, because we have ministers saying that, oh, that was a small incident. It is not a small incident. These lives matter. So yes, that's my summation of the.
Aman, I kind of want to jump on that, and perhaps you can first talk about how your database came together, the methodologies you have been using to document it, and then we could go to Rachel again to kind of talk about how she started this project.
No, quite. I mean, obviously, like the idea when we started off was very much linked to this idea that, I mean, probably it started with the initial few deaths, Ranveer Singh being one of the first ones that Rachel just spoke about. Uh, Unfortunately, there was this idea, or there's this connection that this disease was only linked to the disease-related deaths, and that is something that we were trying to avoid from the very beginning. Because once you bring in like a lockdown or a measure to prevent the disease, these deaths also sort of like, I mean, lost like imagination. I mean, like at least like there were less records of it or less conversations about it. And there wasn't any active effort in terms of tracking it. Therefore, it was somewhere realized that there is a need to sort of put this in place, because, like, I mean, otherwise it's very easy that this slips in. Or, I mean, like, there is going to be very little conversation about it. So just to sort of make sure that there's conversation about it, or just to like make sure that this does not go away from the public memory, and I hope it somewhere reaches institutional memory as well, but like somewhere that was the attempt to sort of put things together. And as quite Rachel pointed out, like there were deaths in terms of migration, and initially when we started off, I mean, we had this in mind, but the number of suicides, number of withdrawal deaths, which have also become like somewhat like sort of like a joke for the internet, like, I mean, something that we need to avoid, like in the sense that like withdrawal deaths come as a consequence of like a serious medical condition. And these are the deaths that we also started seeing. And this is also quite important to record, because these were all somewhere connected or associated with the lockdown. So these little categorizations, and not just in terms of of migrants' journey back home, we saw a number of suicides in terms of isolation, people afraid of the disease itself. There were crimes committed by people like vigilantism, like people were just basically like checking who is violating the lockdown conditions, and there are incidents like that, which I think both Rachel and we have kind of sort of documented. Similarly, is this entire situation that we need to take note of are the deaths that arose because of police brutality. I mean, like a lot of people lost their lives because of the brutality of the state in terms of enforcing the lockdown. I understand that deaths is not probably the only metric to look at it. I mean, it will be rather unfair if we sort of have like such a myopic vision in terms of looking at the human cost of the lockdown. But it somewhere represents that people are losing lives also because of all of this, and how we handle the disease is completely terrible, I feel. Yeah.
And
Right.
sorry, I just had a quick follow-up question. Could you also, before Rachel goes in, could you also kind of give us a general categories under which you are documenting, so that it's a good comparison when Rachel starts talking about the categories under which she's documenting?
Yeah. Yeah, so roughly we have around 9 to 10 categories that we are sort of currently putting like category. I mean, sorry for the lack of a better word. I mean, we're categorizing deaths under. One is exhaustion. We're looking at starvation. We're looking at police brutality. We're looking at lack of medical care. We're looking at crimes. We are also looking at accidents. We are looking at withdrawal deaths. Other suicides arising out of lack of movement, isolation, and other concerns which are directly connected to the lockdown. We have also considering the recent rise in the number of events, like in terms of relief, we are also looking at the deaths on these Shramik trains or these quarantine centers, and we're for now sort of categorizing them, like keeping them as a separate category, and maybe we decide to merge them later. We also keep like huge number of deaths that come under the bracket of unclassified or uncategorized deaths. Those are deaths where we have probably limited information or conflicting reports. So one of the classic incidents, as I just spoke about, like with you earlier before the call we started off with, was this incident how the woman in UP sort of drowned 5 of her children, and there were like sort of parallel reports going on whether this is the story or that is the story. So we've been very conservative about it, though. I mean, there is a very good suggestion that that was a clear case of state denial, or like state trying to force a particular view, because states been trying to do that in terms of all the starvation deaths for that matter. I mean, in that light, I mean, we've kept like a category of unclassified categorized death. I mean, as and when we get more and more information, we try and put it with the other deaths that we have. So yeah.
Rachel, can you talk about how you have been categorizing these deaths and kind of lay out the methodology that you're using?
Sure. First and foremost, I must tell that like Kanika and me, we were almost like working neck to neck because we each had our Twitter threads, and we were. So one of the things that I think Aman has done, which I have not captured, is deaths due to domestic violence and deaths due to depression. I mean, where the person commits suicide because of depression. Now, the thing is, both are equally important categories. But being a domestic violence victim myself, I wasn't too sure how much of a trigger one incident like a lockdown would be. But I still realize that it's a very crucial metrics, because, when you are facing abuse, the chances of abuse becoming intolerable. You are in a house, you cannot go down, you're under lockdown. Your husband also probably cannot go to work. And so you are with your primary abuser 24/7. So I want to say that that's where my database differs from him. I'm not tracking certain deaths that they are tracking, but I think that they are equally important things that one needs to track. So just to start off, like, I think their deaths are at 677 and mine is at 692. I don't want to quibble about the numbers because, like I told you, they're measuring very important metrics, but different metrics. And what I am looking at is, one is migrants on the move. So all the migrants who have been on the move and who have died. And of 692, 250 people have died because of hunger, dehydration, exhaustion. They've just collapsed on the highways while they were walking. They've been walking like 700, 1,300 kilometers. And some of them were just like 30 kilometers from their hometown when they died. Just imagine the feeling that person must have had, like, on the highway, you're just so close to home and you can't make it. So migrants on the move, 250 people have died, road, rail, and this includes 9 people who died just on the Shramik trains, the Shramik special trains. These are all easily preventable deaths. How difficult would it be to arrange food and water at regular points? I mean, this is what the railways have always done for all of us who have traveled by Indian Railways. So, the 9 Shramik train deaths, all these deaths actually could have been easily prevented had the state made arrangements. And also, I felt that some state governments did this thing of, this is not my responsibility, this is yours. Who's going to pay for the migrant workers? There didn't seem to be any empathy for what the situation that these people were facing. And I think the Karnataka government's measure in cancelling trains after a huge public outrage, then, they took back the decision. But the thing is, look at their perception of labor, that labor is at the mercy or at the beck and call of industrialists. And I think migrant labor, so migrants on the move is 250, but I'll just go through the numbers. So people who died from panic over coronavirus is 67, and a majority of these people have been quarantined in the hospital or at quarantine centers or in self-isolation at home. And then you had alcohol-related deaths, 44. Then, suicide by coronavirus patients, people who had tested negative, and that's 8. And then you had suicide due to livelihood issues, and that's 175. After migrants on the move, this is like the next biggest category. And then you have hunger deaths again at 23. And like Aman was saying, there's a narrative that they're trying to push, because with all these hunger deaths, the family alleges that they died of hunger, and the district administration and the police are saying something completely different. And then you have...
Or the railway minister. Sorry to cut you. I was just saying, or the Supreme Court or the railway minister. I'm just adding to your list of people.
Everybody seems to be living in a world bubble of denial. So... And also I'll tell you, in all these categories, be it ambulance deaths, you are dying because you're waiting in front of a queue at a ration shop, or hospitals turning away patients, a majority of these deaths are again migrant workers. So you see that that these people are the most vulnerable. I'll just point to these. There is this category that Aman mentioned called lockdown related murders, and a majority of these murders are by parents. Parents unable to see their child starving for 2 to 3 days, they end up killing their children and then they end their lives. So if you see, there have been 7 instances like this where one father actually had 3 children, he slit their throats and then he ended his life himself. It's really tragic because it seems to be that the government is not doing enough, because many of them had ration cards but they're not received rations. So you're seeing that migrant workers and daily wagers are in this list of 600 plus 692, almost it's going to touch 700 deaths, that it's primarily laborers who are the most affected. It's blue collar workers who are the most affected by all of this.
This kind of brings us to two observations that we had, something we spoke about before it started. One is the observation that Chief Justice Bobde made early in April when he asked, we already giving these migrant workers food in the shelters. Why do they need money? Right? This was again this absolute apathy and not understanding. And the second that happened again, something that Aman raised earlier, is what happened with the Supreme Court again yesterday, where there's a whole thing about calling journalists as vultures, but also shifting the blame to reporters and everybody else and not having it. I really want to go in and talk about two things. One, if both Aman and Rachel could answer this idea of empathy deficit. And second, how our systems are deeply anti poor, anti migrant, anti caste. I was wondering if you can address these and how this also affects the planning and delivery of so many of these policy executions.
Aman, you want to start because it's the Supreme Court. And
Uh,
I mean, they've
I
made
think it's a
two.
general. See, I mean, before I kind of go into that, like, to be very honest, there's this one, like, something that I want to sort of highlight, that this idea or the imagination of who the labor is and how the labor reacts, uh, is like a problem with the Supreme Court, like, I mean, for ever and ever, like, in the sense, like, for instance, had the opportunity to administer a course in labor law this semester. And something that I also I've been talking to with my students about is the language and the imagination that the courts or institutions generally have whenever we speak about labor. And it's not very surprising that like this bench comes up and says something. Obviously, it's shocking because the times we are in. So, I mean, the apathy that existed is not something that is new. Having said that, like it's this entire idea, like it's also very interesting to take note of the fact that when this entire conversation with Bobde was like Chief Justice Bobde was happening, and I mean this entire conversation came about like as to why should we take cognizance of this entire matter. This realization that state itself has created these fragile lives in terms of like, I mean, you do one thing, there is a possibility of like making somebody's sustenance just go away altogether. And this entire connection between what the lockdown was and the lives of individuals like who are just fighting it out for like say basic sustenance on an everyday basis, this imagination somehow seems to be just probably absent. And in terms of the kind of conversations that we are having, it's deeply triggering and problematic. Like yesterday's denial at the Supreme Court, like bordering gaslighting on many, I mean, at many fronts by uh, the SG here was like, is a reflection of a deeply symptomatic problem. And I don't seem to see like how this can just like easily be solved or sorted, because if there is an acceptance that there is some sort of a problem, then I think they will have to acknowledge that there is an issue and they would try and remedy it. So another like a small thing that I want to just sort of connect to what Rachel had also earlier spoken about is like not just going into the terms of the numbers, also the kind of like, I mean, the kind of numbers, like even in our public conversations, like like be it 600 deaths or 500 deaths or 700 deaths, like the idea is the tragedy is immense. And obviously, like for both of us, we need to we both realize, I think, like we all of us do realize that we are just relying on things that are reported. There are so many situations that we do not even get to know or hear about, and the situation cannot just be measured by that. So altogether, like this is just a problem. Like I do not know how to sort of. I don't know. Like I think Rachel, do you have anything else to
So
say? It's
for
just
me,
deeply triggering and infuriating. I'm sorry.
no, and so the human cost, the human cost of it, what he's saying, it is very triggering. For me, particularly, I want to talk about the death of Nimani. Nimani is a 5-year-old child who died of hunger. Her parents literally watch the child suffering for 3 days. And for me, I'm a parent of a 7-year-old. I just can't, like, even if one meal, she's like, she doesn't eat, I worry so much. And I just can't imagine what those parents went through. And if you see so many of these deaths, like I have not actually, I wish I had, but before the interview, but there's a sizable number of children who died in this tragedy, children who were critically ill. There were parents who, there was this parent in Delhi who had walked 10 kilometers to take their child to the hospital, and the child died half a kilometer away from the hospital. So the human cost is immeasurable. And even with regard to people, what about the people who have survived? Because in each of these accidents, like truck accidents and all, you see that somebody survived. Truck migrants on the move, like how is that baby, the 2-year-old baby who was playing with his mother's shroud, how is he going to survive? And how are the people, there are people who are completely paralyzed, who cannot move, who have lost their arms and legs, who are critically injured after these, who is going to compensate them? Because with death, the Uttar Pradesh government has announced 2 lakh, but what about the survivors? Who's going to take care of all these children? So, as Aman says, the human cost is just unimaginable, because the deaths is just a small fraction of the great tragedy that's being played out. The numbers are horrific. I just want to quote one more number here. There is this small district called Gulbarga in Karnataka, and I was talking to the Congress MLA there, and he was telling me, this was the first week of the lockdown. The first week of the lockdown, he told me 55,000 migrants had come back to Karnataka, to his district. And he said across Karnataka, the number could be as high as 3.5 lakh or more. And this was just in the initial days. Now, if you see Karnataka, on, when they said you can register to leave the state, 11 lakh migrants have registered. The news report came out today, 11 lakh people. So, we are talking about lakhs and lakhs of people who overnight find their lives destroyed, and who are not even being treated, like they're not even being given choice. That's, I find it horrific that industrialists, like associations like CII, FICCI, ASOCHAM are making statements that, oh, we should not be letting the migrant laborers leave. They don't have any, they're not being sensible. Like the lockdown is almost over. We're going to restart the industries. Why are they leaving? It is so, the language, it's so tone deaf. I cannot tell you how tone deaf. And I think this, like there is no conversation. I find very few legislators who are actually seriously trying to help migrant laborers get back home, because they also have the choice. They're not here to be slaves or bonded labor here when you want them to be. Like, you've treated them like dirt. My only question to industrialists is, if you wanted this labor, like lakhs and lakhs of migrant labor staying back in the place of migration, why didn't you provide for their food? These people didn't have food. They didn't have a place to stay. That's why they were left with no choice. And imagine, they didn't leave on the first day of the lockdown. They left after 1.5 months. So that's my take on it.
So we have a couple of audience questions, so I'll just put it out. There are a series of audience questions that I'm clubbing them together. One talks about, why was the government so ill prepared, given that the first cases were registered as early as December? I'm not sure if they're talking about India. I think they're referring to Wuhan. The second question says, do you trust the numbers and the data collection that the government does? Is the government collecting data on this deaths? So if you kind of want to address these things, first is a question of, why is the government ill prepared? And that is linked to the question of whether, are they ill prepared because they don't have the numbers? And second, are they collecting the numbers? If they're collecting the numbers, then are these numbers to be trusted? It's a series of them.
Aman, you want to take that or okay? Two things. One we have realized is I was talking to Rakesh Sharma. He's the filmmaker who has made Gujarat, the documentary on the 2002 Gujarat riots. So he was telling me when they were trying to record farmer suicides in Gujarat, the district administration always puts pressure on the family to make it out to be a case of unknown death, because if it were to be a suicide or person who it was a hunger death, then the problem, it will come back to haunt them. So many of these deaths, he was saying that of his own, when they did this data collection, they found 4,000 such deaths in the state of Gujarat had not been accounted for as farmer suicides. Now again, right now currently in Vidarbha in Maharashtra, the district administration has reported 109 deaths, farmer suicides, and we don't know if, and this was just during the period of the lockdown, the 109 the number is, but you don't know how many people died because of the lockdown. Many farmers, if you see, they couldn't bring their produce to the market, and they could not sell, and this season's crop went for a phase. Imagine 3 to 6 months you're you're waiting for the harvest, and then the harvest, you either are dumping tons and tons of produce on the highways, or you're bringing it to the market at like dirt cheap prices. So you're seeing a lot of farmers are committing suicide. But again, that number, I have the number at 175, but it could be so much more, because there is no centralized data collection on these metrics. So if you see, one of our foremost people on journalists on farmer suicides is P. Sainath, and he himself had to go to Vidarbha, sit there and document how many farmers had committed suicide. So that's what it becomes. It becomes very, it is only, you get this information at the district level, not even at the state level. And then you will personally have to start collating all this data, and there's nothing at the national level that I know which tracks, for instance, even our mortality rates. For instance, there was the story in the New York Times as to how the mortality rates in the UK have spiked. So there is a high probability that the government is not accounting for many deaths as coronavirus deaths, because there's the normal death rate, and then a spike. So it's possible that the death count is not 38,000 as the UK government says, but 50,000 or probably more. So you cannot do such a story in India, because we are not collecting mortality rates at the national level. We are not collecting farmer suicides at the national level either. We have centralized data on farm loans, so that gives us an indicator that and farm loans have hit a 5-year low. So you're seeing that that banks are steadily decreasing the loans that they're giving to farmers. So you're seeing them in a tough place, but there's no nationalized data to back up what you feel that they are in a tough place, and there is a huge human cost to all of this.
Should I go in? Yeah. So in terms of the preparation question, I don't know how equipped am I to answer this question, but I'll just say some things that we should take note of. Our problems with with food security have always been systemic. Economists like Ritika Khera, Jean Drèze, Jayati have all been speaking about this issue as to how there is a problem in terms of our food security imagination, how the law sort of operates. Clearly, in such a situation, obviously, when the pressures are really high, it sort of comes out as very evident. So obviously, in terms of our preparation to handle, obviously this is an unprecedented crisis all across, but there are certain basic things that could have easily been sort of fixed earlier, and there are certain things that could have been fixed, say, from the time of the lockdown. See, we have entered the 4th phase of the lockdown. Right now we're in the 4th phase. And it's actually quite difficult to imagine why, when certain concerns have been raised about the universalization issue, why has that not happened yet? There are steps that are being taken, but it's so slow to respond to the situation. Somewhere it is a problem, and that is that problem in terms of preparation. So connecting to what also Rachel said in terms of our understanding of the situation or understanding of problems, a very good indicator or metric of this is also as Rachel pointed out, our disease-related numbers or our mortality rate numbers are these figures are probably all haywire and berserk. A very important instance, again, I just wanted to point out because Rachel brought in the Marathwada incident as well. is this entire issue that came about in Agra, where there were 145 deaths related to tuberculosis patients that came about, and this became a huge concern. Now, say for instance, it was reported that a lot of them did not get timely care. Now, it's obviously very difficult to, for instance, without details about every case, for us to sort of link every situation to the lockdown. But there is a strong possibility, and we've not included this number in our database till now. So it sort of also goes on to reflect that the numbers will keep going on and on. And even with people pointing such things, it is probably, I do not know, like what sort of can drill this sort of an information into the people who are making policies. Like, why are they like being tone deaf, as like Rachel had just pointed out?
Aman, we have a audience question for you. This is very specifically related to the labor laws, and the question is: can you explain to us the conversation around relaxing India's labor laws? Are the current labor laws laws responsible for the economic downturn? Oh God. Second, so they're asking if the labor laws is the reason why India is not doing economically well, or is the dip in the growth rate. Second question,
Yeah, as certain economists also tend to believe.
and also they're asking what will be the consequences, direct and immediate consequences of relaxing the labor law. The only person who has talked about it is industrialist Aziz Premji. Can you please explain this to us? It's very interesting that they're asking some, like the questions that we are getting are so basic that sometimes I wonder what the journalists are actually doing trying to explain these very complex things. But please go ahead.
No, it's interesting to sort of imagine, like, say, for instance, obviously there is this huge sort of a conversation that's spurred up very recently in terms of labor laws being actually not beneficial for the laborers themselves, or also being a reason why the economy is not doing well. First and foremost, let's just probably agree that our labor laws in their imagination are obviously not the very best. But at least there are certain guarantees, like at least the Minimum Wage Act, or the minimum wages, I mean, now the code on wages for that matter, again, it has to be operationalized, it's not operationalized. But the minimum wages, like the guarantee for minimum wages for that matter, that it has been existing for, I mean, at least guarantees something. I realize that there is a huge conversation or debate about the minimum wages not being enough. But that does not necessarily mean that you dismantle the system. You work on the system, you make that system better. I mean, you can't give this argument. Say, for instance, if you also, like, there's another argument that just sort of comes in, that this is the number of the kind of labor laws that we have is sort of making things much difficult for the capital. And that is the kind of argument that, say, for instance, Gujarat is taking, UP is taking, that, like, like there will be a boost in terms of the economy, more people will come in. But that is a very weird and a skewed understanding of how labor laws are. Like, they are anyway, like they have been always industry. I mean, they have been largely favorable to the industry. But the little guarantees that were available, they cannot be taken away. Like the minimum wages, if you take it away, it is directly going against PUDR's idea that would amount to forced labor. And for that matter, like this entire Bangalore episode, where like you're forcing people to stay back and work, like if you are not giving people an option or a choice altogether, that sort of this sort of an economic coercion is like forcing people to work. And that is the kind of probably the society that we are going to get into post lockdown. In such a situation, it is extremely important that there be at least some guarantees. And it is probably very devastating to see how these are basic things that we are just not probably appreciating enough.
We have another audience question, and this one is for you, Rachel. The audience question is: do you think consistent reporting by journalists can actually push the government to change? Are you seeing an actual change in the ways in which the government is responding, given the dogged reporting that has been coming out of a handful of journalists from India?
See, I think some of the reporting, because I mean, the situation has become so bad that, just like a bare bones report, like, I think it was nothing more than the visual, it was just a 1 minute clip of that 2-year-old crying at playing with his near his mother's dead body at the railway station in Nagar. She was traveling from Gujarat to Bihar. So just reporting, just bare facts reporting itself would get the conversation started. But beyond that, what has also happened is that I would blame that like many of the deaths which took place also took place because of the media. I mean, the media at one hand is sensitizing people to the tragedies that have been unfolding in terms of the Aurangabad train incident or this child. But let's also bear in mind that there were 3 people who died only because of their religion. So I've classified this as Islamophobic deaths. 3 pregnant Muslim women who were turned away from hospitals citing their religion. And this is a government hospital. An Indian citizen goes to a government hospital and is denied treatment citing their religion. And then this woman, when she was turned away, she again got into the ambulance, and the ambulance was taking her to another hospital when she delivered the baby, and the baby died on the way. And then there was another case where a pregnant woman was beaten up by nurses and patients because she was a Muslim, because they told her, you Muslims are spreading coronavirus, and they beat her so badly that she lost her baby. And then she also, and I don't know, it's so sick, they made her clean up her own blood. So incidents like this, I think, are happening only because the Tahilbi incident was communalized. And if you see, we have not talked about Namaste Trump, because that was a large stadium in Gujarat, and Gujarat now, if you see, has the highest number of cases. That was a large jam-packed stadium, and at a time when everybody was talking about isolation and flattening the curve, you had this massive event. So how come, so the media seems to be not playing its role of, there should be checks and balances in the system, and I think our media is failing us.
Rachel, this is something that we spoke about a bit earlier. So given that we're talking about journalists, I kind of want to put this question to you. There've been a serious crackdown on journalists on reporting. Even in the last few months, you've seen journalists being arrested, even around simple COVID-related reporting, like even talking to someone who's been affected. Um, do you see that? Do you see journalists being increasingly targeted, or do you place this in the larger context of what's been happening and playing out for the last few years?
It is, there are two things that are happening. One, journalists get targeted, and already the media industry is seeing massive layoffs. You're seeing everyone from Hindustan Times to Telegraph to every newspaper is laying off, media houses, TV channels laying off people in the hundreds. So you have that, and you have this situation where the newspaper industry and the media houses are increasingly dependent on the government, because your government ads form your biggest chunk of revenue. So there is a cost to reporting the truth, and particularly this government, which wants to say everything is hunky-dory and there's like nothing wrong. So you're seeing two things. You're seeing journalists being targeted, and you're seeing news reports going, that's it, they just are deleted. Like news reports about Shramik trains losing their way, you could see many news reports getting deleted. News reports on coronavirus deaths, again, I have no reason, I don't know the rationale behind why these, who takes the call as to that this news report is telling too much of the truth. I don't know if there's something called too much of the truth, but then it disappears. So I think what is needed now is public journalism, where I am seeing on Twitter, and I'm seeing like people like citizen journalism, grassroots journalism, where people are seeing what's happening right outside their doorstep and they're reporting. I think probably that is the only way forward, because with the media industry itself facing such a huge financial crisis, and the government putting out like reminders constantly saying this is not in national interest, where reports are being called anti-national. So I think that is the only thing, that is the only way I see forward.
I kind of want to go back on the other issues that you raised. One about the waves of migration. I was wondering if you can I know you talked about this. Can you lay out the waves of migration that you both have noticed when documenting the migrant deaths?
Do you want to
go first?
Okay. So in the first wave of deaths, not just migration, first wave of deaths, we saw a lot of migrants who died on the move, road train accidents, and we saw a lot of alcohol related deaths. And I don't know why, but in the second half, where again you saw an increase in deaths, we didn't see many alcohol related deaths. And I don't know how to account for this data, but a majority of these alcohol related suicides were in the southern states, and Kerala topped the list. But I also get the fact that there could be underreporting. There could be severe underreporting in other states. Maybe that's why we are not getting the numbers from there, because I just refuse to believe that it's a purely South Indian problem, alcohol. So that is there. And then there was this the wave of migration. So initially what was happening was, migrants, when they wanted to move, they were being told that, don't you guys understand about flattening the curve? You shouldn't be on the move. We're trying, it's for your own good. You're going to go to the villages and spread the virus and all that. While they were saying all this, they were not making any arrangements for them here, for them to stay. So that was the first wave. But in the second wave, we just became even more callous. At the second wave, you saw governments actively trying to prevent workers from leaving. You saw governments actively refusing to make arrangements. You saw people waiting for days together at railway stations and then making the decision to start walking. And many of these people, when I'm talking about the people who died on the way, they had like run out of money. They had run out of money, they had run out of food, and they were walking, they were continuing to walk. So if you see, this is just like, it's so tragic. Imagine not having a rupee to buy yourself even like a cup of tea or something. It is unimaginable. And this, I think, what happened at the second wave, where people were so desperate, like, because the first wave, it was more about people who were daily wagers who couldn't leave, whereas it was in the second wave, you had people who had completely exhausted their savings, who had tried every means to leave the cities that they were working in, and they couldn't get any means, and that's when they took the decision to walk. And many of these people, if you see, they're walking with their children, they're walking with their wives, and these babies are. There was a woman who, we are not tracking, me and Aman are not tracking, because we're only tracking deaths. But to talk about the human cost, there was a pregnant woman who walked 1,200 kilometers at the final stage of her delivery, gave birth to a baby, rested only for 2 hours, and continued walking another 200 kilometers. I mean, and then you saw that woman who cycled, that little girl, 15-year-old girl who cycled 1,000 kilometers, and you see Ivanka Trump, saying that, wow, this girl is so amazing, she could become a cyclist. It's so tone deaf. Ivanka Trump could be, India's daughter, because she perfectly reflects our ruling class, and them constantly getting it wrong as to why this person was forced to. This person wasn't thinking, I'm going to break a world record, I'm going to, make it to the Guinness Book of World Records. No, they were forced to. They were desperate, and they took such measures. So I think there is this very wrong reading of news reports, because the news reports don't want to be critical of the government. They're trying to be as neutral as possible in the reporting, and then you have ministers and Ivanka Trump getting completely the wrong picture from these news reports. So that, I feel, is a problem between the first wave and second wave, where the lack of empathy and reports, keeping it to a minimum, keeping it to a bare bones minimum, because you have to report as a journalist, but at the same time you don't want to piss off people in power. And so I think this is where the message is completely getting skewered. That girl who cycled did not cycle because she was a cycling enthusiast. She cycled because she had no other choice.
That brings me to another question. We actually have a question for you directly with the migrant crisis. So feel free to defer it if you want to. Please ask Aman to speak about Sudha Bharadwaj and Gautam Navlaka and other prisoners, particularly more vulnerable ones currently held in prison. We are also getting a news update that Vara Rao has actually been admitted in the hospital now, that he's really seriously ill. Aman, would you like to take this question?
It's kind of not connected, but yeah, technically, like, yeah, it is a bit of a problem. I mean, like, I'll just give like a very small one-liner, because I think something needs to be said about it. Yeah, it is a deeply problematic thing how political crimes are being like sort of like state is actively hunting people. Like, it's not just these big wigs, but also like people in Jamia, and there are like so many cases that are happening. But I wanted to add something to Rachel's point earlier. Do we have the time to do that? I mean, in that situation, I just want to talk a bit about the trends.
We also have a lot more questions coming in, so it completely depends on you guys. If you want to stay on, we can stay on and have this conversation.
Sure.
I just wanted to add.
Yeah.
I'm also good for for a bit. I just wanted to add a bit to what the phases essentially like. I mean, again, like, to be very honest and to be very frank with you, like, again, like, I have we have as a team very incoherent ideas in terms of how these trends are sort of like, it's very difficult. It's too early probably to talk about or to do a proper sort of a trend analysis. Also, none of us sort of claim to be like proper experts in terms of saying like give a very definitive answer. Having said that, there are certain trends that we see with each category. All right, yeah, there are migrants on the go, and there is a probably a clear defined trend, like because there were road accidents earlier, then road accidents increased again after a few weeks, and now when we see like there is a third wave also in terms of like deaths in relief action, and that is also something that we need to talk about, that the kind of relief that we are providing is not good enough. And clearly the number of deaths that are happening in Chhattisgarh in quarantine centers, because a lot of people are trying to pick it up, and in Jharkhand, is just a conversation that this sort of, Chhattisgarh for that matter, the kind of deaths that are happening in quarantine centers and the kind of deaths that are happening in Shamik trains are also should not be sort of lost out. This is the third. I mean, people are dying in relief measures. So, I mean, we can only imagine how serious our relief measure efforts are. The other thing I also want to talk about is in terms of like, again, like we sort of borrow from other people's ideas in terms of like looking at suicides. But like if we see like people who are dying by suicides, the number has also seriously fluctuated. The reasons that are, I mean, that we see are kind of changing like as we proceed with the lockdown. So earlier, yes, there were situations where the withdrawal, yeah, probably the reason that like withdrawal sort of affects some sort of situation, some people, they develop psychosomatic sort of symptoms and that sort of, and they succumb to those. That sort of then translates into like a number of suicides that sort of rise in terms of like isolation. Those are things that obviously continue, but maybe like, but a number of suicides, deaths by suicide that rose were actually because of financial distress. And the numbers that we are currently seeing are either largely sort of to be placed between either some sort of an isolation issue, but like mostly lockdown rules have somewhat been relaxed. So, I mean, we haven't really come across as many. But a number of like financial distress deaths, like things that like Rachel also spoke about, the deaths in Marathwada, the farmer distress deaths, and those are things that are coming up, and those are things that we are afraid that are likely going to rise until and unless something's done about it. Similarly, though, police, the crackdown by the police has sort of also come down. I mean, clearly because lockdown not as in force. So again, like with the patterns with each category that we have, it's important to take note of that. And probably there is an associated reason. We have our database out in the open. So if anybody wants to sort of do this analysis, is very happy. I mean, we're more than welcome. Like if somebody wants to take this up, somebody who's like probably has.
Just to take off on the Marathwada deaths, remember the 109, and we were both like puzzled, like whether should we account for this, should we add it to the table or we shouldn't add it to the table. Going to the Marathwada deaths, like I put it down in suicide due to livelihood issues. And if you see, the suicides due to livelihood issues are only migrant workers and farmers. No other section in society. You don't see professionals, you don't see anybody else dying because of livelihood issues. And again, suicide from panic over coronavirus, yes, there are some professionals, there are like some software engineers, doctors, frontline workers, like doctors who were working with COVID-19 patients, then people, healthcare workers, disaster management, like the responders, the COVID-19 responders of the district government. So these people have committed suicide, but again, that's a minority. You seeing a majority of these people have ended their lives because they were afraid they had got coronavirus, because they were put in a quarantine center. And these migrant workers, I think there was like this, the doctors or the healthcare workers, nobody bothered to tell them, explain coronavirus and the probability that, because they're just in their 20s and 30s and 40s, they're not likely to die of the disease. So I think there was an extreme lack of awareness in telling them why they were being quarantined, because if you see, many of them, they ended their lives and within an hour or within a day their test results came back negative. So, I mean, this is an unnecessary death we're talking about. So that has been happening frequently. And like he said, the third wave of deaths, like, with relief measures, with the Shramik trains, I'm seeing that there are a lot more people dying. Like on the Shramik trains, 9 people have died. And like he said, suicide due to livelihoods. The third thing that's happening is hunger deaths. and mostly these are children or they are older senior citizens, and one member of the family is the sole breadwinner and they have not been able to work. And these hunger deaths also, it is really sad that the district administration is not acknowledging these deaths and is also not ensuring that, like, a ration card, many of these people did not have a ration card, or even if they did have a ration card, they were not receiving rations. So when the news report is there, you hear the family saying that they still don't have food to eat. So I think, even while, like, denying that this death happened due to hunger, like, the least you could have done is ensure that rations were provided, that the family had enough to sustain itself. So I think this will be the main three problems going forward, that, financial stress, like, what are you going to do because these migrant workers who commit suicide when they go back home, they are staring at their dependents and they don't have any means of providing for them. I mean, they would have stayed in their own villages, right? Like, if there was a way to sustain themselves there. So that, I think, would be the biggest problem going forward.
I think we have the last 7 minutes left. So what I really want to do is we have a lot more audience questions coming in, but I'm just going to pick a few. One of the things that I also want to talk about is the question of um, accounting for caste and class. This is something that you both of you spoke about. It's about how even in your categorizations, we are not categorizing these based on caste, and caste being one of the biggest killers in India just by the existence of the deeply violent systems it entrenches. So that's the question. We have a bunch of questions. I'll put it out there. Perhaps both of you can address it when you talk about it. The second question is, what do you see happening in the next few months? So the question of they're asking you to kind of, based on the data that you're collecting, what trends do you predict in the coming months? The other question again looks at, again, why was the government so badly prepared, whether it's the central government or the state government? Why is the Indian state, that is supposed to be a state that is giving out, which is built on social security measures? We have a public distribution system, we have public hospitals. An Indian state built on these values, why is it failing so badly? So these are the questions. So I would kind of, since we're coming to the end of it, perhaps both of you can address the questions that you want, and then we would move forward from there.
What was the second question, if you don't mind? Just like it just was taking down. Like I just missed the second question that you just pointed out. One was caste, and the other intersectional identities.
So one was caste. One was about
Is a public system.
Yeah. Why is the public system failing? And then again about predicting the future. What do you see playing out in the next? Given your trends, what do you see happening in the next few months?
Should I take the caste question, and maybe you could take the one on public hospitals? Like, why is our government not rising to the challenge? No, only because, I've been asked this question before about caste. And so that's when I did like a small recce and I noted down all the reports where it said that a Dalit person had died. So yes, so again, going by these reports, I'll tell you one instance of police brutality. There was this boy called Roshan Lal. He was a Dalit worker, and he had been so badly beaten up by the police that he had broken his right arm. And he said, like, with my right arm no longer functional, how will I work? So he committed suicide. So, but unfortunately, what's happening is because the migrant worker, like the media has caught on to this whole migrant worker. It took me 4 newspaper reports before I realized that the boy was Dalit, because everywhere else he had been referred to as a migrant worker who had come. So that maybe it's a good thing that we are focusing on the fact that these are migrant workers and they're going back home. But I also think that you should be looking at the caste dynamic. Like, I'll point to another example. The woman in Jharkhand who was forced to clean up her own blood, that woman was also from the Dalit community, one report said, but another report just said she was a Muslim. So you have these conflicting reports. I don't know what to go by, but I am seeing a lot of the people who are vulnerable, who were turned away from hospitals, who were denied healthcare, they were Dalits. There were a few reports saying that they were Dalits, but again, like, you will find in each of these instances when it happens, there'll be 3-4 newspaper reports, and many of them will refer to them as a migrant worker or a daily wager rather than refer to their caste. So I think that is a problem in India, where maybe we don't want to acknowledge that these people were members of the lower caste, and that's why they face discrimination.
Well, caste, I mean, it's a very small point that I just want to add. Caste is obviously like one of the intersectional identities. Yeah, obviously we need to also look at other vulnerabilities. Other vulnerabilities sort of also sort of make this entire issue, like age is a factor. There are other things, disability could be a factor. There are multiple of these factors. Again, like obviously reporting is not very clear on this, and therefore some scratching needs to be done. There is a need to do that. Coming to the question on preparation, I honestly feel that I'm not the most equipped to talk about it, but to be very honest, like people have been talking about this entire issue, that like we're facing this as a consequence because there were sort of gaping holes in our system, and they were never plugged at the time they could have been. And even with repeated sort of like telling like or repeated reminders that these are issues, like universalization of PDS was like one great example for that matter. uh, Nothing is being done about it, or very little is being done about it. And the last is in terms of like there was a question on prediction. I really don't think I have the competence to sort of predict trends, but I can only say like probably that I hope that there is, with things like with time, like things just magically get better. I mean, I was just hoping that with the disease as well, that things just magically just disappear and things get okay, because otherwise, I mean, with this tone deaf sort of attitude, I don't see how we're going to go. Like, it seems like a little difficult to sort of imagine how bad things are going to be. It's terrible, but yeah, like, I'm sorry, that's my take.
Um, we've already gone half an hour beyond, so I think there's a lot more questions, which also shows that there's hunger for really trying to understand and make sense of this. Before we finish, last concluding remarks, and then we will wrap this up. Rachel?
Uh, okay. For me, I think these deaths point to only a small percentage of all that is going wrong today. Going back to what he said about the labor laws in Uttar Pradesh and Madhya Pradesh. Now, in fact, Karnataka government is also thinking of changing the labor laws, and the former labor commissioner here, Mr. Captain Manivannan, he took some extreme measures to ensure that migrant workers got food, got wages, and then he was transferred. He was transferred, and he wasn't even given a new posting. And at that point, when I asked the Karnataka Employers Association, KEA, and then the Karnataka Small Scale Industries Association, KASIA, they openly admitted that yes, they had sent complaints to the Chief Minister's office that they were extremely unhappy with this labor commissioner. And so the labor commissioner got transferred. So you're seeing that the industrial lobby is working, and that the industrial lobby is able to more successfully push their demands and their agenda than people. And if you see, these are all basics. The minimum wage in Karnataka for different sectors is around 10,000 rupees. And, to do away with that minimum wage, I was talking to the people at AICCTU, and they were asking, why can't one of these legislators who decide these rules, try living for one day on 180 rupees or 200 rupees a day, and then they will realize how difficult it becomes. How are you going to account for food, rent, travel with just that figure? And if you see, after the labor commissioner was removed, there were more punitive measures brought in. Laborers were told that if you don't show up to work, then we have the right to take legal action against you. Now you tell me, at a time when even the public transport buses had not started operations. So there is no acceptance of ground realities, that it would be difficult for people to work. It would be difficult for people to work under these circumstances. And you are seeing labor laws being done away. For me, the most shocking thing about that Uttar Pradesh and Madhya Pradesh, the day that the UP and MP government decided to do with labor laws, including safety and health norms, was the day of the Vizag accident. So the Vizag episode, if you remember, more than 1,000 people were critically injured. The Vizag gas leak. There was this gas leak at this plant called LG Polymers, and 23 people died, and there were 1,000 people who were injured. And that, if you see the day of the biggest gas tragedy, and everybody, there were so many media reports likening it to the Bhopal gas tragedy. On a day like that, like where India has seen like its biggest gas tragedy, and there's massive amounts of reporting, you're doing away with labor laws that were meant to have these norms in place, that were meant to protect workers, that was also meant to protect your own industry. I mean, your industry going up in flames or having a blast is not in any way going to improve your records. So I feel the way forward is to put more money into people. I think people like Manmohan Singh realized that when they brought in the minimum wages, when they brought in revisions in the minimum wage, because someone like Manmohan Singh understood that, like, if you put more money in the hands of people, and particularly people at the bottommost strata of society, then they're going to spend more, and when they spend more, the economy as such gets a boost, because people have a higher disposable income, and if more people have a higher disposable income, it helps in boosting the economy. Rural economy grew. You saw that India's GDP was growing at 12-14% under his regime. So there are these measures, I feel, which really helped India in the past, and doing away with these measures like minimum wage is really not going to boost the economy. It's not going to boost the economy, and it's a very short-term measure, I think, to inflate the profits of industrialists. It will not help in any. I don't think it will lead to large-scale demand rising. Like, I mean, making sweatshops in India like China and Vietnam is not, I think, the way forward. And it is definitely, and it will not encourage people to come back. All these migrants who have left now and gone back to their home states, it is not in any way going to encourage them. If you're going to tell them, oh, we are going to have harsher measures, and we're going to treat you like slaves, it's not going to in any way entice them to come back to Bangalore or to come back to Bombay to work. So that's like my take on it.
Concluding remarks, Aman?
I don't have much to add, actually. Just a very small thing, that I'm just going back to the database and the deaths that we are recording and the exercise of it. I hope that, I mean, with this platform, it's useful. Like, this conversation was extremely important and useful and necessary, for that matter, that people talk about these deaths, not just in terms of the numbers, because numbers, like, again, like as Rachel pointed out at the beginning, will vary across databases with the methods and the processes that we have. But the four of us do keep in mind, and the four of us, like Tejesh, me, Krushna, and Kanika, the four of us have just one simple idea behind bringing this out, that this conversation should sort of like at least be there. And I mean, I think like somewhere a few years down the lane also, when we're looking back, I mean, this tragedy that we see in terms of numbers of deaths that have happened because of the lockdown, because of the measure, should not escape memory. Elections will also come by then, I presume.
Yeah. No, thank you so much for your time. Thank you so much for your effort. And more than anything else, always thank you so much for repeatedly speaking truth, which seems to be oddity in these times. At the end of this conversation, we will be putting the links to both Rachel's work and the work that Aman does with a group of other researchers and scholars. Again, thank you so much for joining us.
Thank you. It was a pleasure, Suchitra. Thank you so much.
Thanks. Bye-bye.